My name is Fernando, and I do the earwax removals for my hearing clinic, and I also provide service clinics for NHS hearing for the NHS patients over 55s. If you look at people who worked in the old coal mines or in the noisy industry environments like engineering or anything like that, they never wore ear protection or wasn't counseled as properly. So now they're suffering from it. The things like it's not just the hearing loss, it's with conditions like tinnitus or damage to the inner ears and things like that because of the noise and because of the dust, because of the chemicals that they use and things like that. So now you're coming across the past generations and we're dealing with elder generation who had to go through the hard times and now suffering from it. And then you have from the younger days, like from my generation, who's been wearing the earplugs to listen to the Walkmans and the CD players, and now the technology's moved on. We're still using them, but the damage in long term that it does, I myself suffer from tinnitus, which started, I think, it's because of the music trend that I carried on without using any protection at all. So these things will carry on, and I don't think it will ever stop, but we got to find, there's no cure for it, but we have protection now, and we have capabilities where we can supply the people with hearing aids if necessary to supply the hearing that they lost. If you think your hearing is good because one side is okay and the other side is deteriorating, but you're ignoring the fact, you can turn your head around and the problem is solved, but it doesn't. In long term, the balance wise, it can be affecting your lifestyle because your brain's trying to adjust to where the sound's coming from, especially when you get up in the morning, you need a second to settle and things like that. And when you're walking outside or somebody's shouting across the road or cars coming and the traffic's moving around, and your brain's always working hard to concentrate through one side of your hearing and the other side is very dull or no hearing at all, then if you can accommodate some hearing loss with a hearing aid to balance that out, then your brain's going to cope much better and your lifestyle is going to become much easier, and also might prevent something like vertigo or any dizzy spells, things like that. Everybody produces earwax, so some more than the others. Some might be one ear, some might be both ears. But people who regularly produce wax normally knows when it's building up and blocking, because your hearing is going to be quite dull. You can hear your own voice, but not everybody else's. And also sometimes if you're fully blocked with the earwax and you haven't looked for any treatment or anything like that, and especially if it is your first time, you don't know if there's any earwax, it's always good to get a check done just to see if it is the earwax that's causing the dullness. And sometimes it can cause pain here because of the pressure in the canal and give you headaches, and also that can cause you dizzy spells if you have especially if you have balance issues. But it can affect, because of the pressure in the middle ear doesn't equalize, not always. If both of your ears are blocked or one is fully blocked, then that can cause a little bit of balance issues as well. We use a microsuction method, and it's vacuum technique that we use, and basically we go use speculate, look inside, and use loops, head loops, to look to provide the vision and the light that we need to see inside the ears, and then we use the vacuum suction to suck the wax out, as long as it's been treated well. We always advise the patients to use oil at least 3 to 5 days before the appointment, because some wax can be quite hard. It could have been there for a year, but wax needs to be loose. It needs to loosen itself off the dry skin that the ears produce inside, because if it is matted up with, we all have hairs and some more than the others, it could be matted up with the hair as well as the dry skin inside your ear, and it could be quite hard to take out. So if that's the case, we'll have to send them back home, ask them to use oil again for a week and bring them back. But to save the hassle, we ask them to use ear oil or almond oil, anything, something kind to your ears, to loosen the wax up, loosen the skin, and then the suction is quite easy to do. It's one of the safest methods, I think, because we don't go anywhere near the eardrum or anything, and we don't put anything in the ears other than oil, which is kind to your ear. And as long as the wax is soft enough, we suck it up. Normally, if a person is producing wax, if it's a patient who's always had wax problems, then it's always going to be a checkup, at least depending how often they have wax removed. If they're getting wax removed 3 times a year, then obviously you need to get a checkup every 4 months or so throughout the year, just to make sure it's not fully, getting blocked up. But it's always good to get the ears checked before it gets blocked up. That's when you need the treatment to start, putting a drop of olive oil to help out, so it eases the situation, as we say. With regards to the hearing, we do the free hearing test, and we provide you with the hearing aids if you want to purchase a hearing aid, or if you want to go ahead considering hearing aids, we can give you the correct advice. And also, once you come for a hearing test, before we do a hearing test, we give you a general checkup anyway, just to see if your hearing's impaired with earwax or anything else. And we can also send referrals to the GP if we are concerned about any situations, where you need to have a bit more of a health check, just to make sure everything's working fine. We can do that. And generally we look after everybody's health. We put their health first before anything else. And everybody so far claiming to have a good experience with us, so I think it's great.